a little bit more boisterous, a little bit more, soft-spoken. You're just putting it between your teeth and kind of like rubbing your teeth a little bit. It's not really cleaning anything. There's nothing special about floss. It's a piece of string. You're not cleaning anything.
Dr. Zach is a big flosser. And he took the spoon excavator and he stuck it up underneath the patient's nose and goes, "You smell that? You smell that? That's why we brush our teeth." And you can just smell like the rottenness. We dentists are also not immune to dental work. We also need it ourselves.
Welcome to Minty Fresh Takes, presented by Enamel, the podcast where we explore the latest trends, science, and personal stories behind oral wellness. I'm your host, Xander, and today we have a jam-packed show covering some of the most important topics in oral care. From celebrities to experts in the field, you're sure to hear dentistry content done in a fun way. So sit back, grab your popcorn and your floss because you'll need it after, and enjoy this conversation. Thanks for listening.
Welcome back to another episode of Minty Fresh Takes. I have the honor and privilege of hosting Dr. Zach Abrath here, another dentist here at Niceville Family Dental, my dental office, with us today to dive deep, answer some questions that all you viewers want to hear and know. So let's get right into it. So the first question I've got for the viewers is, people want to know, every dentist is different. People want to know some of the differences between you and me, the yin and the yang between the two of us.
I would say treatment principles were very in alignment, which I think is important whenever you're working together with someone in an office, because you don't want to be kind of going against each other when you're seeing the same patients. Kind of messes things up, can confuse the patients. I'd say the biggest differences between us are just personality types. Obviously, you are a little bit more boisterous.
Just
That's one way of saying it, where I'm a little bit more, soft-spoken. I think I'm the more, level-headed of the two. I run on kind of a flat line. Little peaks and valleys tend to be out of a wide range. So some patients want calmer and some people want excitement. So it gives the patients a good opportunity to kind of pick and choose what the best personality match is for the treatment that they're getting. So
I couldn't agree more.
That's the biggest difference.
Yeah, I think so. I couldn't agree more. Yeah, the most important thing is we have the same philosophy on teeth and dentistry, and so that's the most important thing. All right, so let's dive into a little bit about how do you view the process of taking care and cleaning your teeth?
Okay, I don't think we've ever talked about this, but I've done my thoughts on what the correct order of all the things are. So
the order of operations.
I'm kind of curious what your take is on it too, because we've never actually talked about this. So if you think of the main things that you would do for your dental hygiene things, you got your brushing and flossing, and then a lot of patients use a mouth rinse. Some patients use a water pick, and those are kind of the main tools and implements that most people have as kind of their routine. To me, there's kind of an ideal order that makes sense for just what you're doing and the goals behind it, right?
Okay.
So to me, the first thing that you would want to do is flossing. And the reason being is that flossing is you have a piece of string and you're just putting it between your teeth and kind of rubbing your teeth a little bit. It's not really cleaning anything. You're just kind of debriding some little bacterial colonies that started forming there. You're just trying to loosen everything up. It's not really there's nothing special about floss. It's a piece of string. You're not cleaning anything. Okay, so you got it all loosened up, and then I think then's the time you would want to go through with your water pick, kind of flush around there, or you could be doing more if you want to do a mouth rinse at that time. That's kind of the best time to do that. Kind of rinses it out, kind of detoxes everything. Everything's loose. And then you go through, you have your toothbrush, you got your nice toothbrush, and you got your enamel, obviously.
Obviously.
What else is there to use?
Obviously.
And it's essentially a medicine. You're putting it on your teeth. You're not just cleaning your teeth, but you're treating it with that microhydroxyapatite to help remineralize and desensitize the teeth. And the last thing you want to do is rinse all that off with a mouth rinse right after. You don't want to be throwing Listerine and just rinsing it off your mouth. So
well, you'd
the
be
last
using
thing you want to do,
mouthwash tablets.
Well, you could do that before, but that's more, but you just don't want to be, if you're doing the traditional methods, I feel you need to be, whatever your active ingredient, whether it's the microhydroxyapatite or if you're using an older toothpaste like fluoride or something like that, it needs to be on your teeth overnight. You don't want to be rinsing all that off if there's no need to. So that's my take.
My take would be, because they wanted to get my take too, this is why we make great partners, because I would 100% agree. I'm based in logic.
Okay.
So floss removes the big gross amounts of food between the teeth and plaque. Mouth rinse makes sense next, and then last but not least, just brushing to make sure everything's completely fresh and clean. So I agree with order operations.
All right. Cool.
Concur. Okay, this is going to be a fun one. So, Dr. Zach is a big flosser. If you've watched this podcast, I am not a big flosser. So, Zach, let's talk about why that is. So let's talk, first question the viewers want to know is, let's talk caries risk.
Okay.
And your caries risk versus my caries risk.
I guess just historically, I've had a few more cavities than Dr. Harper has. We've both seen each other's teeth, and we've had some work done. But yeah, so I guess I would put myself in a higher category. I do have a bit of a sweet tooth also. I'm responsible and everything in moderation, of course. But I feel like it is important for me to floss. It's not like I ever floss and I don't find something. I mean, there's always something there that you're gonna get out. And this is really gross. But I had a friend in like dental school, and he's like, if you wanna make people floss every day, tell them to like floss their teeth and smell the floss afterwards. And just do that every day for like a week, and you'll notice it still stinks. Like every time, it's still nasty.
Oh, I can't imagine.
So if you really want to motivate people that are like really motivated by kind of gross things like that.
I have a fun
that's what
story
I like
on
to
a
do.
dental school story too. I had a professor in dental school, I'll never forget. He was working with a classmate of mine, and he's taking out the decay on a tooth. So like taking out the caries on a tooth with what we call a spoon excavator, and it was a massive cavity. So it's like just peeling up, like just disgusting. And he took the spoon excavator and he stuck it up underneath the patient's nose and goes, "You smell that? You smell that? That's why we brush our teeth." And you could just smell like the rottenness, you know? That might be why he's a professor and not in private practice, but it was a very take-home point for that patient that, man, we got to brush. All right, guys, so back to the flossing discussion. Why does Zach floss and I don't? I'm going to give my 2 cents on what I think. One, obviously we have different bacterial compositions of our mouth. That can affect things too. I've looked at his x-rays, he's looked at mine. I think the other thing too, that his shape of his teeth is slightly different. So he has more gaps between the contact areas, if that makes sense. His contacts are more pinpoint versus broad. And so I would say that's probably why he also gets a little more food stuck in there as well. You do have a history a little bit of recession. I think you had an experience with that in dental school.
Yeah, I've had several gingival grafting procedures done after my braces with my kind of triangular shaped roots and everything. I just had a lot more gum recession, so had to get some surgeries to help that. And I do have kind of bigger spacing between the teeth, so.
Some further proof, guys. We dentists are also not immune to dental work. We also need it ourselves.
I got a root canal, gold crown. I got it all. So.
See, we're not immune to it either. We don't all have perfect teeth. We need to do the same things y'all do. So let's talk. How often are you telling patients to floss?
I mean, if you're going from 0 flossing to some flossing, that's like the first step. Like, if you got the patients that like don't floss at all, I just want to like just a good faith effort. Try to do 100%. It like once or twice a week. Like
change that routine up a little bit.
Right, just start switching it up. I mean, and then you have the ones that. I mean, I've had some patients that are the ultra flossers, and you're like, okay, you're doing a little bit too much flossing, and you're like actually traumatizing your gums. But honestly, it's just about taking that next step forward in whatever the progression is. I don't think it's like. You definitely are not going to get someone who never flosses to floss every single day out the gate. And I mean, you're going to miss a day here or there. It's not the end of the world. Just
yeah, piggybacking on what he said, what I typically will tell patients is if you're only going to do it once a day, do it at night. That is the most critical because you've had food all throughout the day. Doing it in the morning is helpful too because you do have those 8 hours you're sleeping, you do have plaque biofilms that'll develop, and the floss can help remove those. Especially if you're a heavy tartar builder. I'm talking about you, periodontal patients that need to be at the dentist every 3 months. But that being said, I think if you're going to just start adding it to your routine, switching up the routine, new year, new you type thing, start doing it at night. That is the most important time because you do not want that food and food particles sitting between the teeth overnight. Well, cool. Well, Zach, it's been great having you. Thank you so much for your time.
Pleasure.
Thank you for giving us some time away from patients to join us on the show today, and hope to see you again soon.
All right, I'm gonna go pull a tooth.
Sounds good. Go have fun.
All right.
Hey guys, thanks so much for tuning in to another episode of Minty Fresh Takes, presented by Enamel. Listen, we all know people that are into the latest trends for their oral care. We also know people on the other side of the spectrum that are not. This show is made for both of those people. And so if you could do us the absolute biggest favor and share this, like, comment, subscribe, but make sure to share this with your friends on both sides of the spectrum and somebody right in the middle, that would be awesome. Our biggest mission here, not only doing this podcast, but with all the products and the dentistry here in Niceville, is to ensure the trust and the quality of product that we continually offer to our patients. Our mission through this show and through our brand new product Enamel is to ensure that your teeth are being covered by nutrients that actually benefit your teeth, i.e. microhydroxyapatite. Our toothpaste tablets that we have right here, toothpaste tablets and the luxury mouthwash tablets, these are both available at enamel.com. That is ENML.com. And if you're looking for more information on microhydroxyapatite, feel free to check out our latest YouTube videos. Like we said earlier, make sure to subscribe to this channel. You don't want to miss anything that we have coming out. And thanks so much for watching. We'll see you on the next show.